Today, we are cracking open the official playbook for treating the most common types of skin cancer. We're going to look at all the options, the big decisions, and the strategies that doctors use, and all of it is coming straight from the expert clinical guidelines. Let's jump right in. So, where are we getting all this info? Well, our guide for this explainer is the official clinical practice guidelines for keratinocyte cancer from Cancer Council Australia. And look, this isn't just some random article. This is the document that doctors actually use to make treatment decisions. We're basically getting a look over their shoulder to see exactly how they tackle this. Okay, so let's imagine this scenario for a second. A doctor finds a spot, a biopsy comes back, and it's a common skin cancer. All of a sudden, you're hearing a bunch of new medical terms, talking about different treatments. It can feel like a lot. So the big question is, what happens next? How do you and your doctor figure out the right path forward? That's what we're here to map out. To make sense of it all, we're going to think about the treatments like tools in a doctor's toolbox. First, we'll get a handle on the challenge itself. Then we'll open up the surgical toolbox. After that, we'll check out the non-surgical options, then the heavy-duty tools for advanced cancers, and finally, we'll talk about the all-important follow-up plan. Okay, first things first, let's understand the challenge. What exactly are we dealing with here, and what's the real goal of any treatment? The official medical term for what we're talking about is keratinocyte cancer. Now, that just sounds fancy. It's really just the umbrella term for the two most common skin cancers out there, basal cell carcinoma, or BCC, and cutaneous squamous cell carcinoma, also known as CSCC. We're talking about the ones that millions of people are diagnosed with every single year. Now, here's what I think is so important, and it's right there in the guidelines. The goal isn't just to get rid of the cancer. The official aim is to minimize the impact on a patient's quality of life. That means every single decision is a balance between getting a complete cure and making sure the outcome looks and feels as normal as possible. It's really about treating the whole person, not just the spot on their skin. So with that in mind, let's open up that toolbox and look at the first set of tools. We're starting with the surgical options because these are by far the most common and effective treatments we have. The number one go-to tool is surgical excision. It's pretty much what it sounds like. The cancer is physically cut out, along with a tiny safety ring of healthy skin around it, just to make absolutely sure no cancer cells get left behind. The guidelines are clear. This straightforward approach is the most common for a reason. It offers the best shot at a cure. So how good is it? Well, the numbers kind of speak for themselves. For typical low-risk skin cancers, surgery clears the cancer 98.35% of the time, on average. I mean, that is an incredibly high success rate. It's exactly why surgery is considered the gold standard. But, not every job requires a hammer. Sometimes you need a scalpel with incredible precision, and that's where Mohs micrographic surgery comes in. This is not your standard procedure. It's a super specialized technique designed to get every last cancer cell while saving as much healthy skin as humanly possible. And that's absolutely crucial when you're working on sensitive areas like the face. The way it works is actually pretty amazing. A surgeon takes off a super thin layer of tissue. Then, while you're waiting, that tiny piece is mapped out, frozen, and checked under a microscope. And here's the cool part. If they see any cancer cells at the very edge, they know the exact spot to go back and take another tiny sliver. They just repeat that process until the samples are totally clear. It's so meticulous. So it all boils down to picking the right tool for the job. You've got a simple low-risk spot on your back. Standard excision is perfect. But a cancer on your nose or near your eye, or maybe one that's come back after a previous treatment, that's when the precision of Mohs is often the absolute best choice. But what happens if surgery isn't the right fit for some reason? Well, the toolbox has a whole other section for that. Let's look at the non-surgical treatments. These are more specialized tools for very specific situations. A really important tool here is radiation therapy. This uses focused beams of high-energy radiation to zero in on and destroy cancer cells. It can be the main treatment all on its own, or it can be used after surgery as a kind of cleanup crew to zap any microscopic cells that might still be hanging around in a high-risk case. So when does this get used? Well, the guidelines lay it out. It's a solid option if a patient decides against surgery, or if for some medical reason surgery just isn't a good idea. It's also used after removing a high-risk cancer to lower the odds of it ever coming back. And it's a go-to for really large tumors or ones that keep recurring. Next up are the destructive therapies. Okay, that sounds a little intense, I know, but it really just means treatments that destroy the cancer tissue right there on the surface of the skin. The two big ones are cryotherapy, which is basically freezing it off with liquid nitrogen, and electrodesiccation and curettage, which is a scrape and burn technique. Cryotherapy, the freezing one, is a fantastic tool, but it's for very specific jobs. It works best on small, clearly defined tumors and usually on the body, not so much the face. Why? Well, it almost always leaves behind a little white patch. And for most people, that's not a cosmetic result they want on their face. And see, that brings us right back to that quality of life goal we talked about. And finally, in this group, we have topical treatments. Think of these as powerful, medicated creams that you apply directly to the skin. Now, they're not for deep cancers, but they are great as a field treatment. That's where you treat a whole area of sun damage with lots of precancerous spots, or for some very, very superficial types of basal cell carcinoma. Okay, so everything we've looked at so far is for the more common, lower-risk situations. But what happens when a cancer is more aggressive or more complicated? For that, doctors have to open up the advanced toolkit. So what makes a cancer high risk? It's actually not just one thing. It's a combination of factors. Doctors look at things like, is it big? Is it growing deep? Is it in a tricky spot, like on an ear or a lip? Has it come back before? Or is the patient's immune system weaker for some reason? Any of those can be a red flag. For these high-risk cases, the whole approach shifts. It's no longer a one-person show. The guidelines call for a multidisciplinary team. You've got surgeons, radiation experts, cancer doctors, all collaborating. And if the cancer has spread, the treatment might shift to what are called systemic therapies. These are drugs that work throughout your entire body to fight the cancer wherever it might be. And that brings us to our final and maybe one of the most crucial sections, the follow-up plan. Because really, the treatment itself is just the beginning of the story. After treatment, the goal is pretty simple. If anything is going to come back, you want to catch it early, period. For patients who had a high-risk cancer, that could mean seeing a specialist every 3 months for the first couple of years. And really, for everyone, getting into a routine of self-checks and regular professional skin exams is just a critical part of staying healthy long-term. So when you step back and look at this whole toolbox, it's pretty incredible. The tools we have to treat these common skin cancers are so effective, with cure rates that are way up over 95%. And that brings me to one final thought to leave you with. If we're this good at treating it, what does that tell us about how important it is to prevent it in the first place? Thanks for watching.